Hello and welcome to India Top Doctor. Today we are back with another episode of the Health Dialogue, and today we'll talk about the need for awareness about cancer. Cancer is one of the most common disease found in India, and you may have seen us interviewing doctors specialized in oncology, and it is because this disease is among the deadliest one. IARC released an updated Globocan 2020 with new estimates on the global cancer burden, indicating that it has risen to 19.3 million cases and recorded 10 million cancer deaths in 2020. And these numbers are still counting. So today we have a very special guest to talk more about it. Dr. Tejinder Kataria. She is a renowned radiation oncologist who is the chairperson of Medanta Cancer Institute. So please let's welcome her. Welcome to India Top Doctor, ma'am.
Thank you.
As you know, today we will talk about awareness regarding cancer. And you are a specialist in radiation oncology. But before we start, can you tell me what is radiation oncology and how does radiation work?
I think that's a very good question to start the dialogue about radiation therapy and radiation oncology. Radiation is actually X-rays. And in this subject, we use very high energy X-rays, beyond 4 million volts of energy or 6 million volts of energy, which is targeted in a very pinpoint way into the tumors. And the energy can vary for a photon energy from 4 million volts to 21 million volts or 18 million volts. And if we go to proton therapy, then it can go up to almost 250 million volts. So it's a very, very high energy, but it's targeted in a very sharp and a pointed way, accurately within the tumor and takes care of the tumor. So how does it work? What does it do? Right? A simple X-ray will show you a chest finding or maybe some bone fracture or something. That is only a few electron volts of energy. That's a simple X-ray, or a CT scan, which is also a few kilovolts. So this high energy, what it does is that it breaks the backbone of the cancer, which is the DNA. Everybody knows about the DNA today. So that is where the genetic code of the tumor is stored and from where the cancers are growing. So radiation breaks that code for the cancer to grow. So that is how it kills the tumor and helps the body recover. And those breakdown products are then removed by the body as they are not required.
Right.
Like we take food and whatever is required from the food we absorb. Whatever is not required, our liver and the kidneys and the gut, they remove that. So same way, when the tumor breaks down, the breakdown products are removed. And there is a high end of radiation, which is known as radiosurgery, where we give a single treatment of a very high dose. And there not only the tumor cells are knocked out and killed, there also the blood supply, which the tumor is deriving the nutrition from, is completely eliminated. So that is a different form of radiation, a higher form of radiation, which also helps not only the cancer cells, but some non-cancer tumors which are sitting close to the brain or close to the eyes or in the spinal cord, like vascular malformations or schwannomas, neuromas. So they cause pain, they cause functional loss. So radiation works in those areas also.
Okay,
I hope that explains the subject.
That does. And actually, you gave a certain idea of my next question too. But still, can you tell me some other different, techniques which are used in radiation oncology that are different from other treatments when we cure cancer?
Right. So here I spoke about the radiosurgery. Then we have the fractionated radiation, which is the conventional radiation, which happens over 4 to 6 weeks. And then we have intensity modulated radiation, which has been around for last 20-25 years, where the radiation is, modulated by the movement of the multi-leaf collimators within the machine. And that creates independent segments to irradiate the tumor to a certain desired dose and protect the surrounding structures, because the tumor is not sitting in isolation. It's within the body parts. So if there's a tumor, let's say in the food pipe, and it's sitting in the center of the chest, very close to the lungs, very close to the heart. So how do we protect the heart and the lungs? We don't put anything from outside. Within the machine, we have something known as multi-leaf collimators, and these leaves move independently to shape the tumor in the esophagus. And the modulation of the radiation protects the heart and the lungs. So that is what is the intensity modulation. And then when you put the patient on the machine, how do you verify that the patient is lying in the same position and the tumor is going to get targeted? So there we do an image guidance. So that's an in-room X-ray or a CT scan which is taken, which will verify that the machine is going to irradiate where it is needed. So that is an image guided radiation. And the third one, which is very important, is brachytherapy. These are the forms what I discussed are teletherapy, like you are talking to me through the teleconsult, right? And that's from a distance. We do teleconsult, we see the television. So similarly in teleradiation or teletherapy, the machine is far away from the patient. The patient is lying on the couch. The machine is almost about 100 centimeters away from where the radiation is coming. But then in brachytherapy, brachy means near, right? It's a Latin word which means near. So brachytherapy, the radiation is kept close to the tumor. It's kept within the body. So it can be, case in example, the food pipe. We place a small tubing inside the food pipe through which the radiation is mounted, and then you remove the tube and the tumor has been irradiated. Or in women cancer, especially cervical cancer, there's a lot of discussion about that because you can prevent it with vaccination, you can early diagnose it with pap smear, and it is highly curative with radiation, even in advanced stages. And it is the single most important curative therapy for cervix cancer, that is brachytherapy, where you can deliver a very, very high dose, protecting all the structures, because there the dose fall off happens within millimeters. So you give maybe 100 units to the tumor, and at 5 millimeters, the dose is less than 20. So that is the kind of sharp gradient you can create. So that is known as brachytherapy.
Okay. And can you tell me, are there any changes that occur in skin after radiation therapy?
Yes, if the skin is directly getting irradiated, there would be changes. Earlier, when we were using a cobalt system or we were using, deep X-rays, then the skin used to get a lot of dose. But the radiation forms that we are talking of today, they are known as mega voltage, as I alluded to earlier, of million volts of energy. Then the skin does not get that kind of a dose because the build of the radiation occurs below the skin. But in certain cancers like breast cancer, you have to irradiate the skin, or a patient with the larynx cancer where the head and neck is being irradiated, or a cheek cancer, the skin would get a dose. So the main changes that occur are that the skin gets pigmented. We have melanin below the skin surface. Those melanocytes, they get kind of stimulated, and there is darkening of the skin, like a deep tan when you're exposed to sun. And it is limited. It is limited to the time when we are giving radiation. Starts happening sometimes by the third week, and towards the end, it's really dark. Then within a month, it goes away because we form our skin tissues. Every 6 weeks, they are renewed. And you have seen yourself that the skin, there may be a change because of an injury, but then after some time it heals. So similarly, we use the skin's healing properties with radiation, that it's produced to a certain degree and then it heals. Then some patients, you may find that there is a breakdown. If they are, applying something which is not permitted during radiation, or the dose is required for a skin cancer, then there may be a breakdown. But that also heals over the next 4 to 6 weeks. So radiation-induced changes on the skin are not to be afraid of. They are a part, let's say that they are a kind of orchestra to the songs. If you're just singing, then you may not enjoy it so much, just the words. So this is the music to the radiation, and it's a side effect which is produced in a kind of a measured manner so that the body heals itself.
So in those circumstances, it's not that harmful, but still, do people need to take any special precautions like staying away from sun or avoiding any people with infectious diseases like that?
Yeah, because the patients who are undergoing cancer treatment, their immunity is low, so they should avoid getting infected on the area where they're getting irradiated. So anybody having fever or an open wound should be avoided to get in contact with. Secondly, we ask them not to go in direct sun because the sun will irritate a skin which is exposed to radiation. And there are also the hair follicles over the skin, they go away. So there's no oil there. The hair follicles and the sweat glands which produce the sweat, they also dry up with radiation and they recover over 3 to 4 months. So during that time, post-radiation, we tell the patients to cover their skin with a cotton cloth. They should wear cotton next to the skin because that doesn't got the irritation. Any synthetic or woolen cloth would irritate that. And direct sun exposure is avoided because that will cause, again, irritation and itching. Plus, we give them emollient creams. In case it gets infected, then we give an antibiotic cream. Otherwise, we give steroid-based cream. Or now we also have some herbal preparations like from aloe vera or calendula. So there are proprietary preparations which are given and they have been tested widely across a lot of patients so that they don't cause any dermal allergies or anything. So those are what we give to our patients.
Okay.
And patients can have a bath every day. There's no restriction to not having a bath. Like earlier times, we used to tell the patient not to take a bath, No, they take a shower every day. They can apply a small amount of soap and clean themselves, because otherwise it can get infected.
That was really informative. Can you tell our audience about, will you suggest like any special diet they can take after the therapy?
Not only after, I think during therapy also it's very important. We start preparing them during the preparation mode only for the radiation part. And as we talked about the cancer getting broken and being removed by the body, so the body needs a lot of good nutrition. And the healing processes happen through protein intake. So we ask the patients to double their protein intake. Like for a 50 kilogram person, we'll ask to take 100 milligrams of proteins per day, 100 grams of proteins per day. So normally for a normal wear and tear or living purposes, we need 1 gram per kilogram body weight of protein. But patients who are undergoing radiation, we tell them to increase that to 2 gram per kilogram body weight, but not go beyond 100 grams per day. So the dietitians help them make a diet chart depending upon what their preferences are. Because in India, by and large, 70-80% of the population is vegetarian. And then the people who do take non-veg, then they are accordingly given their preferred foods. In addition to that, they need multivitamins, adequate amount of fats and carbohydrates. And in radiation, there is no restriction on taking fruits. Like in chemotherapy, you must have heard that the patients don't take fruits or raw foods. In radiation, that's not there. And after the radiation is over, we continue the same regimen of high protein, high calorie intake diet for about 6 to 8 weeks. And subsequently, to prevent the cancer from coming back, we ask them to go on to a high alkaline diet. You must have heard that the cancer grows into an acidic medium. So if the body's medium is acidic, then the cancer has a higher chances of coming back, or it will grow. So there we ask the patients to get in touch with the dietitian and create a diet which feeds the body medium to become alkaline. So these are the kind of recommendations which we make to our patients.
Okay. So you just said before that skin has an effect, right? We get an effect on skin sometimes, but other than that, other than skin issues, what are the other side effects that cause after the radiation and how are they managed?
Well, the cancers are not one disease.
Right.
And they can affect any part of the body. So the side effects will depend upon the site or the part of the body which is getting treated. Okay, if somebody is getting treated in the neck and the food pipe or the respiratory passages are getting affected, then they may have a cough or they may have difficulty in swallowing solids. Then there we have to give them the nutritional advice for taking semi-solid, soft diet, liquid diet. If somebody is getting treated in the abdomen area, right, what you call the tummy area or the abdominal area, then in that case, they may develop nausea or they may have loose motions. So in that case, we give them diets which don't cause nausea, avoid heavy fried foods and take light foods. And if they get diarrhea, then we ask them not to take leafy green vegetables, not to take plain milk because that can add to the lactose intolerance, and then give them foods which are appropriate for their absorption, right? And then there may be patients like who have something which is happening within their brain and they get radiation for the brain tumor. Then the swelling inside the brain can cause headache or nausea, vomiting or dizziness. So it's, kind of organ appropriate. The management is also organ appropriate for these patients.
Okay. We have seen that not all types of cancers can be treated by radiation therapy. Is it true? Can you name some of the types of cancer which cannot be treated by radiation therapy?
Well, that was probably true 30 years ago when I was doing my residency, maybe when I was your age. That time it was true. But as of today, like I said, that we have something known as radiosurgery. So truly today, there are no radio-resistant tumors, so to say. Earlier, it was said that the sarcomas are radio-resistant, or renal cell cancers are radio-resistant, or bone tumors are radio-resistant. So it's not the question of the radio-resistance or not responding, it's the amount of dose which you can appropriately give and the techniques that you can appropriately deploy so that you don't harm the normal tissues. The normal tissues or the skin can tolerate maybe around 6,000 units of radiation. But if the tumor requires 10,000 units, how will you give? That will lead to a damage to the skin, right? Or to the heart, if you can give only 3,000 units, right? Or 300 units. But the tumor in the lung needs 6,000 units. How will you give? So those techniques were not available earlier. The techniques have developed, computer algorithms are available, imaging is available, CT, MR, PET. So, there are a lot of aids which are now helping us target the tumor to the doses which are required to knock them out. So this is where we are. And technology is very advanced. Whatever technology was used during the World War II to knock down the, aeroplanes, the radars, right? Those are the kind of technologies which are deployed into the linear accelerators today. Okay, the technology that was required to make a hydrogen bomb is deployed into our machines today. So you see that there's a very high energy which is perfectly targeted to the tumor, and it uses a kind of GPS. So how do you use a GPS on your mobile? You are somewhere in part of Delhi, right? And we get to know that there is a crowding there, there's traffic, we should avoid this road. So through the satellite, it's not yet started happening here, but maybe in future it does.
Future, maybe.
Yes, maybe.
Thank you so much, ma'am. You have given us so many valuable information today. My last question will be about you, actually. As a frontline worker, how do you manage to follow all the COVID protocols and be safe for you as well as your loved ones?
I think that's a very good question coming at the tail of the pandemic, which I hope we are seeing the tail of the pandemic and it doesn't get stuck. So we follow the COVID protocols of, appropriate personal protection equipment. While I'm talking to you, I have one mask which I've taken off. I have another mask which I've kept there. So I use a double mask when I'm in the clinic or I'm out of the house. Then we wash hands with soap and water or alcohol rub appropriately wherever we have to. And it's constant, the whole through the day. And for protection of my loved ones, I go back home, take a shower, and change completely before I go around anywhere. So the loved ones open my door, I don't even touch the door, So although I wash my hands and everything, then I go back and try to take a nutritional diet, do my meditation so that I maintain my positive energy. And within the department, because it's a protection for my staff also. So we've applied all the COVID protocols of distancing. The patients are made to come in such a way that there is no overcrowding. We follow the schedule where we treat the patients on the machines. About 100 plus patients, 150 patients are being treated per day in the department. So we start the machines at 6 o'clock in the morning and give them a 20-minute slot period, although the treatment time is just 5 minutes. So that they get adequate time to come in, change, follow the COVID protocol, keep the masks on, and the staff is able to clean their accessories. So we've increased our time from 10-minute slot to 20 minutes, so that everything is taken care of. Even the machine room is sanitized at the end of the treatment with ultraviolet rays. So a lot of precautions have been taken, and the hospital and the staff has really risen to the demand of what it was extra, or what was required for these patients. And that's how we've been able to tide over through the pandemic, and we continue to treat our patients. We never stop the treatments.
Okay, it was really good to talk to you, ma'am. Thank you so much for being with us. I know how busy you are and you've taken time for us. Thank you so much for that.
You're most welcome. You have a good day. Bye-bye.
And if you guys want to book an appointment of Dr. Kataria, you can do the same by visiting India Top Doctor. Till then, be safe and keep watching India Top Doctor. Thank you.